All right, Dr. Jenny here. We're working through our third video for our second trimester movements. So again, we're really focusing on a little bit more strength and range of motion. So this time we are going to go into lower body. We are going to pair together two bigger lower body movements. We are doing a squat into a reverse lunge. So really focusing on our mobility, sitting those hips down and back. We're up, lunge back and in. Good. Squat it down. Watch those knees tracking outwards. Lunge back and in. So working on two different ranges of motion with that pelvis as we're working through this movement. So nice and slow, looking at your form of utmost importance. Knees are tracking out. Good. As you lunge back, again, we're very mindful that those knees are not caving in. We're keeping them at least parallel with the big toe, if not activating that outer glute to push it out a little bit more. Good. One more other side. We're sitting down, up, lunge it back, and in. Okay, shoulders, okay? Huge for postpartum. We're gonna do some single doubles. So press, and both. Good. Press, and exhale both. Exhale, press. Exhale, press. Good. This is a good chance for you to think about, can I pull my belly button in? Can I still control those abs a bit with my breathing pattern? Good. Exhale, and both. One more set. Press, and two. Good. Okay, lateral lunges. One of my favorites. Shoulders down and back. Two weights this time. We're going to step it to the side. Weight frames that foot or knee. Nice exhale as you drive off of that foot, standing up. So we're really stretching that inner leg, outer glute as you come up. Nice step. Good. So you really want to keep those inner legs and outer glutes working for you as much as you can through the second trimester, because as you hit your third trimester, hormones plus where you're at in your pregnancy, your pelvis starts to widen. Those glutes start to struggle keeping your pelvis stable. So we really need to use these other muscle groups that should be working, but usually we don't work them enough even before pregnancy. So you want to really work them this trimester to help give them some stability for you in that third trimester. Okay, perfect. A little bit of core and some shoulders. We're going to do some push-ups. From your knees, I want the top of your feet to be touching the floor. That helps you activate those lower core muscles a little bit more. Okay, rotating those elbows in, trying to keep those elbows as close to your spine as you can or your side body as you can. We're going to inhale down, exhale, press. Inhale down, exhale, press. Inhale down, exhale, press. Good. Your range of motion, you can go up against the wall or a very sturdy chair. Two more. Inhale, exhale. So chest and core and press. Nice. Okay. One of the muscle groups for mobility this time, we're doing hip flexors. So for a lot of women, again, they're a muscle that we kind of forget about when we're stretching that can remain tighter in your third trimester and cause you some pubic bone discomfort. So we're going to be proactive and work on mobilizing that now and comparing kind of side to side where that is. So stepping that foot forward, we're going to stick those hips underneath you. And so just doing that, for a lot of people, you can feel how that lengthens a hip flexor on that bent knee side. You can add a bit of a forward translation there to add a little bit more. Then you're going to come back to neutral. You're going to grab that wrist and pull up and over. And that should open up that part right by your ASIS or that front bone in your pelvis. And then up, and then some nice controlled rotation towards that knee. So really kind of working all the different ranges of motion of that hip flexor or psoas. So again, tuck those hips under, lean forward if you need to, accentuate that stretch a bit. Good, and then back, because this muscle goes right under your uterus. So there can be a lot of pressure depending upon position of baby on this muscle, and this muscle can create a little bit of issue for you in that third trimester if we're not working on continuing to lengthen that muscle out. Okay, run through that a couple times if you need to. Again, we really want to keep that one balanced. So if you're noticing one side versus the other is like, wow, I can really feel that, or gosh, that range of motion feels tremendously different, please do that a couple times to work on creating that better balance through that exercise.